Our first speaker today is going to talk about how TCM complements Western cancer treatment. You see, whenever we talk about cancer treatment, Western medicine usually takes a spotlight. So it may surprise you to learn that Eastern medicine can play a very important and complementary role alongside Western treatments in managing cancer as well. So, ladies and gentlemen, today's topic is hand in hand, East and West. So we're going to invite physician Lim to share the core principles guiding TCM's approach in complementary cancer treatment and the various TCM modalities suitable for it. So ladies and gentlemen, without further ado, please join me as we welcome physician Lim Tze Chao.
Good afternoon. My sharing, it's on the role of TCM in cancer complementation. Next. So a brief introduction about myself. I acquired my PhD in TCM with a focus on cancer complementary treatment from Liaoning University of Chinese Medicine. Before that, I completed my master's degree in TCM from Beijing University of Chinese Medicine and a double degree in biomedical science and TCM from NTU. Next. Okay, so my sharing today will be divided into these three segments. What is cancer? How do you reduce the risk of cancer? And how does TCM come into the picture? Next. Okay, so what is cancer? So cancer by definition are cells that grow uncontrollably and they are able to spread to other parts of the body. So from the diagram on your right, you can see that there is normal cells and cancerous cells. So the cancerous cells, they will grow uncontrollably and they will invade the healthy normal tissues. And as they invade and they go deeper, they will gain access to blood and lymph vessels. And from there, they will be able to spread to other parts of the body through the process called metastasis. Okay, next. So how do you reduce the risk of cancer? Next. So before you can see a few common risk factors. So let's take some time to look through them and think about which of them you can control. Okay, so I'm pretty sure everybody have your own conclusions. This circled in red. So next. Okay. So those circled in red are risk factors that you can control, unlike age and genetics, which is out of our control. So for alcohol is associated to the increased risk of quite a few alcohol-associated cancer. Individuals who drink 1 cup a day and binge drinkers, whom by definition for women, 4 or more cups in a sitting, and for men, 5 or more cups in a sitting. So both these groups of individuals have a modestly increased risk of developing cancer. Next is obesity. So being overweight or having obesity, again, is linked to an increased risk of cancer because being overweight can actually cause your body to be in there'll be a few changes that will occur due to you being overweight, and one of the more common one is chronic long-term inflammation. So such inflammation will injure and damage your body, and it means to say that the longer you are overweight and the more you are overweight, the higher the risk of developing cancer. Carcinogens or cancer-causing substances, they can occur naturally in nature, such as aflatoxins, which is produced by fungus in poorly stocked grain, or they can be man-made in nature, such as tobacco. So for tobacco, there is no healthy safe usage. Tobacco is actually one of the leading cause of cancer and death from cancer. The reason is because tobacco products contains many chemicals that actually damage the DNA. For infectious agent, they include virus, bacteria, and parasite. And again, they cause changes in your body, which includes causing long-term inflammation, lowering of immunity, and they can even disrupt the the cell control mechanisms. Okay, next. So how does TCM come into the picture? Next. Next. So from the Western perspective, a few common treatment methods include surgery, chemotherapy, radiotherapy, and targeted therapy. Next. Next. Okay, so depending on where an individual is with regards to their Western treatment, before TCM, before Western treatment, while they are waiting to the Western treatment, TCM, the aim of TCM is to boost the immunity while strengthening of their body in preparation for the upcoming Western treatment. Next. So for individuals who have received Western treatment, have completed their treatment, the aim of TCM is to boost their immunity while reducing the chance of reoccurrence of cancer. And for individuals who are unable to accept any Western treatment, while boosting of their immunity, TCM will seek to attempt to stabilize the tumor. Okay, next. So what is the principle of TCM that allows TCM to achieve this aim? And the core principle is balance. More specifically, the balance of the yin and the yang. Okay, so why is this balance so important? This will be illustrated in the following 3 slides. Next. Okay, so in this diagram, you can see forest, the forest is flourishing, the plants is growing very well. And the reason is because the yin and the yang, they are in perfect balance. And this is the state that we want our body to be in. Next. Okay, so this is one end of the spectrum. So you can see that there is flooding. And the reason there is flooding, because yin is in too much excess. And this will be problematic for the body. Next. Next. Okay, so you can see in this diagram, there is drought and there is forest fire. And from the TCM perspective, the reason is because the yang is in surplus. And again, it will be problematic for our body. Next. Next. Okay. So how does TCM seek to achieve this end? Next. Okay, it will be done mainly through these few treatment methods: robotic twin, acupuncture, electroacupuncture, as well as herbal medicine. Next. Next. So, in general, where there is something lacking in our body, something that is in deficiency, TCM will seek to strengthen and nourish this aspect. And where there is something that is in excess, TCM has to eliminate it. And this is to achieve next, a balance in the yin and the yang, and a healthy spleen and stomach. So why do I single out the spleen and stomach? Before I go into the detail, I'd like to share a bit about the difference in perspective between the spleen and stomach from the Western and TCM perspective. So from the stomach standpoint, TCM and Western perspective both perceive it as part of the digestive system. It's a digestive organ. However, from the TCM perspective, the spleen is an integral part of the digestive system, whereas from the Western perspective, the spleen is part of the lymphatic system and is involved in the immune system of our body. Okay, next. So the reason I single out spleen and stomach is because they perform 2 vital functions. First, through digestion, they separate the useful from the useless. And they are involved in the manufacturing of blood. and both of which is critical for the strengthening of vital T. So vital T is a TCM concept. It encompasses many aspects of our body, including energy and immunity. Next. So now it's a general overview. So in cancer individuals, the most common underlying reason is a weakened spleen and stomach. And usually after Western medical treatment, this aspect is even weaker. And coupled with poor digestive functions and emotional dietary imbalance, T stasis, phlegm stasis, and food stasis will result. So the weakened spleen and the stomach, this is the part that is lacking and the part that TCM has to nourish. T, phlegm, and food stasis, this belongs to the toxins that I believe you hear TCM physicians say quite regularly. So this is the useless stuff that TCM has to remove. Next. So now I'd like to share a few common TCM recipes. First is the tonifying soup for the blood and qi. Next. Jiao San Xian Tea. Next. As well as the Zhi Ying Tea. Next. So here you can see a table that summarizes these three recipes. So the tonifying soup for the blood and qi, as the name suggests, it restores the qi and the blood of the body. Jiao San Xian Tea is actually just to help with the appetite. Zhi Ying Cha, it seeks to help with the dryness, especially after radiotherapy. Next. Okay, so now I'd like to share a few anti-cancer foods that you can incorporate into your diet to have some anti-cancer goodness in your daily lifestyle. Next. Sweet potato. So sweet potato is a very good power food. It contains a lot of antioxidant, which can help protect the body. In addition, sweet potato contains beta-carotene, which is converted to vitamin A in our body and is important for a healthy immune system. Next. Mushroom is another power food. It contains many nutrients such as antioxidant, vitamin, selenium, and folate, and all these help with the upkeep and protection of our body. Next. So garlic and onions, these are two regularly used vegetables in our meals. So they contains antioxidant, which protects the body, and they help with the lowering of inflammation in our body. Next. Nuts. So nuts is another good food. It contains a lot of unsaturated fatty acid, vitamin E, and antioxidant, and they can also help with the bringing down of inflammation in our body. Next. Pomegranates. So in pomegranates, there is seed and juice. So both of which contains anti-cancer properties. So to reap the most benefits out of pomegranates, it's actually recommended both the seeds and the juice. Next. Okay. So now I'd like to talk about another important aspect, regularly used treatment method in TCM, acupuncture. So when we talk about acupuncture, the first question that comes to your mind, is it safe? So to answer this question, next. Okay, I'd like to share with you this article published by SGH in, if I'm not wrong, 2018. So next. Next. Okay, so in the past, 14 years, SGH has been doing acupuncture for more than 68,000 cases, acupuncture treatment cases, and they have reported zero adverse reaction rates. So this shows that if acupuncture is done according to protocol, it's actually very safe. Next. Okay, so now that we know that acupuncture is safe, the next question is acupuncture effective? Next. So in 2003, WHO recognizes 28 diseases, symptoms, or conditions for which acupuncture has been proven to be effective. And they include nausea and vomiting um, after chemotherapy, as well as cancer pain and cancer-related fatigue. Next. Next. In addition, in 2018, Straits Times published that acupuncture is being offered at 4 public hospitals, and the government pledged 10 million funding to help develop TCM. So this shows that TCM is gaining popularity and its effectiveness is becoming more recognized. Next. Okay, so how does acupuncture? Acupuncture involves the insertion of very thin needle through a person's skin at specific points of the body to various depths. And I can't stress enough, it's very important that acupuncture is done based on TCM theory. So meaning to say, I don't just acupuncture wherever I like. Okay, so what are the 2 important aspects in acupuncture? They are meridians and acupoints. So when you look at the diagram to your right, you can see that in that figurine, there is many colored lines coursing throughout the body. These are the meridians. So the meridians are like expressway that brings the vital qi all around your body. And acupoints are found on these expressways, and it's believed that at these specific points, the vital qi will rise to the surface of the body, and if it's stimulated via a needle, it can bring about better circulation and the strengthening and restoration of the body. Next. Okay, so now this is a very commonly used acupoint in the clinical setting, called Nei Guan. So it's to help with nausea, commonly seen after chemotherapy. So how do you find it? You place 3 fingers at the back of your wrist, and just beside the index finger in the proximal joint, in between the 2 tendons, is where you will find this acupoint. Next. So from TCM perspective, TCM is not just a treatment method. TCM is also a lifestyle. So in the clinical setting, other than administering treatment, I would also recommend lifestyle changes. Includes sleeping early, regular exercise. Health Promotion Board actually recommends 150 to 300 minutes of moderate activity throughout the week. And of course, for the diet, it will involve eating regular meals, eat on time, don't eat too full, don't eat too fast. And of course, the diet should be a well-balanced meal. And this actually concludes my sharing. Next. Now I'd like to share a video to share about this robotic tweener machine that is found in Parkway.
Your tweener session today will be provided by a robot.
Huh? A robot? Okay, so doctor, can you tell me more about this robotic tweener?
So robotic tweener, later you'll be lying flat and there will be an arm from the machine that will go down at specific points in your body to massage the muscles. The strength of robotic tweener over traditional tweener can be summarized into the following few points. Robotic tweener can provide clinically precise massages. It can cut down on prolonged human contact. It is safe, and it can potentially provide more comfortable, longer massages.
Actually, I feel great.
At first I was a bit scared because it's a robot after all, but then after actually going through a session, it feels like the robot knows what it's doing. The acupoint was precise, the pressure is just right, and then even the temperature, it was a bit warm because it actually mimics a human's temperature. It's like there are people tapping me, but then it's like the thing that's tapping is inside me.
So for certain conditions, for example, acute pain, skin conditions, or digestive issues, Western medicine and Chinese medicine can go hand in hand to improve the overall condition.
Okay, so thank you. So this is the contact email that if you are interested, if you have any inquiries, you can call to make an appointment. Next. So these are the two clinics. Okay, so I will hand it back to you, James.
Thank you, Physician Lim. Wow, robotic twin arm massage machine. Well, I'm really curious. I would love to try that myself. All right, so for those of you who would like to try that, please put yes, I want to in the chat box. And of course, for us to make sure the chat box is working. All right, now, ladies and gentlemen, for those of you who would like to have any questions, all you have to do is to put them into the chat box and we'll collate them and we'll get to them in just a while. Now, thanks, Physician Lim, once again, Physician Lim Tze Chao, our TCM physician from Parkway Shenton.